every organ, every part of your body is controlled through your nervous system. In fact, your body lives if the nerve that goes to that part of the body is alive. In other words, if the nerve dies, whatever that part of the body is, whatever that organ is, that part of that organ will die. A good example for everyone to understand what we're talking about is diabetic neuropathy. So what happened in diabetic neuropathy? The nerve that goes down the leg to the foot, that nerve dies because of the diabetic condition. And so since that nerve dies, all those tissues, all the organs in that area, in the foot, dies as well, and so then you get gangrene. And so what happens? You have to cut the foot, and so to save the rest of the foot, because the gangrene is going to continue moving up. So, and that's again because the nerve dies first, and then that part of the body dies. So if you take that, that's extreme. So you get an understanding of why the nervous system is important. So, but if you take that same nerve that goes, let's say, goes to your kidney, okay, and if the flow is, the flow is, let's say, 100 per second, okay, and then there's pressure on that nerve that goes to your kidney. Now, if the flow is only 50%, guess what? The kidney is not going to be working 100% its capacity. It's kind of like if you have a light and you dim the light with a switch. That gives you less flow of electricity, so the light, it's not gonna emit as much light as it would if you have the switch all the way up and give it 100% of the electricity that light bulb needs. So that gives you a good analogy as to why it's important to make sure that your nervous system, nerve flows through your body. And that's really basically, that's the philosophy of what chiropractic is about.